Hi everyone, I'm Stacy. I have brachymetatarsia and I just went through the toe lengthening surgery last month, November 22nd, 2017. So I wanted to start posting some YouTube videos to talk about my journey. My first video is just gonna kind of be like a bio about myself. And as we go on, I'll talk about recovery. You'll see lots of pictures and we'll talk about how I was feeling before, how I'm feeling after the surgery, and how I feel after recovery. So be sure to tune in and stay current with these videos. I noticed recently that not many people were recently posting on YouTube about their brachymetatarsia, which is completely fine, but I wanted to come from a different perspective, a fresh voice. So all the videos that I was saying were more than 3 years ago. So I wanted to start this back up again and just be that voice. And I'm also coming from a perspective of a plus size woman. And I'm noticing that some things are different with me than other women who are who have made videos in the past. Women who are who weigh significantly less than I do, how their recovery is a little different from mine. So I want to talk a bit about I want to touch a little bit on that as we go on. So for the first video, we're just going to talk about, like I said before, my name is Stacy. I'm 27 years old. I live in Florida, South Florida, and I realized that I had brachymetatarsia in about middle school when my toes just kept growing and then there was one that just stayed. I only had brachymetatarsia on my left foot, so it was very obvious that something was different with my feet because your right foot, all the toes are the correct length, and then there's just one short toe on my left foot. So people would be very, a lot of people, their eyes would just gravitate towards my toe. I actually have two older brothers, and one of my older brothers for many, many years called me alien toe, which was tough, but we also grew up in a family where we had to roll with the punches. So I just took it as a joke. But as I've been getting older, I realized that I had a lot of anxious moments where my anxiety was high. Pedicures was tough for me. Going to people's houses where they want you to take off your shoes was hard for me. So I started looking into fixing the procedure. Actually, when I met my husband, he was my boyfriend. When we were dating, I never wore my sock. I never took off my socks around him. And one day, a couple months later, he's like, you never take your socks off. And I was like, yeah, because I don't want to show you my feet. And he's like, is it that serious? And I was like, well, it is to me. So one day he kind of finessed me into taking my socks off. And he's like, oh, that's no big deal. I know what that is. And he did a quick Google search and he told me what it was and how I could get it fixed if I wanted to. But he was like, I don't see a problem with it. I saw a problem with it because not only did it give me anxiety as far as how it looked, but it hurt. I couldn't wear certain shoes. I found out later that it was contributing to back pain. And when I had pedicures, and there's a point in the pedicure where they massage your feet, and that part was painful for me because I would always tell the person doing the pedicure that you be gentle with this foot because the skin is really sensitive around my short toe. But they would always just rub it too hard, and the skin where my short toe is really sensitive, so it would tear and it would bleed, and there would be this high intensity moment where they're like, oh my gosh, she's bleeding, and I'm just trying to run out of the salon with my with my dignity because I was so embarrassed. So my husband talked to me about my options about getting it fixed, and for years we've been married for almost 2 years, but we've been together for almost 7. And this is when a couple months into me meeting him. So it was a long time of research. I did a lot of research, and I actually, a couple years, fell upon someone's Instagram page where she was documenting her journey through her toe lengthening surgery, and she had it on both feet. And I saw who her doctor was, and I saw that her doctor was in Maryland, and now I'm in Florida, and I was like, I don't think that's going to work out. But I was still determined to figure it out. I saw 2 podiatrists here in Florida. One told me to cut my toe off because it doesn't serve a purpose, which really threw me off because I'm not going to walk around with 5 toes on one foot and 4 toes on the other if I can help it. But the other podiatrist said, of course we can lengthen your toe. We can put the external fixator on it. But we won't be able to get you the length that you need for it to look normal. He was saying that he can only stretch it as far as to my pinky toe. So that made me uneasy, but I was still gonna go with him until I started talking to Dr. Lamb. He's the doctor who was in Maryland, who I really wanted to do my surgery, but I just wasn't sure how I was going to get to him. I sent him emails. He spoke to me and he's like, no, don't cut off your toe because that doesn't make any sense. And he told me, yes, I can get your toe longer than your pinky toe because it's my 4th metatarsal. For those of you who don't know what brachymetatarsia is usually, usually women have brachymetatarsia. Majority women have brachymetatarsia, and it's when your 4th metatarsal, usually your 4th metatarsal on your foot, just stops growing at a certain point in your life, and the rest of your toes keep growing. And that's what happened to me. It's my 4th metatarsal on my left foot. All my toes are regular length except that 4th toe. It's the second to last toe. So I sent him pictures and I sent him x-rays, and I at one point I was like, am I kidding? Like, I'm not going to go to Maryland to have my surgery because I can't afford it. And I received a phone call the summer of 2016, and he was telling me, he was like, stay put. Don't worry about it. I'm moving to Florida. I'm receiving a job in Florida at a state-of-the-art facility called the Paley Institute, and we'll do your surgery there. I felt like it was a sign from God, to be completely honest. And I said, you know what? This is going to happen. By the end of that summer, I had to quit my job so I can go back to school, and I didn't have health insurance. So here I was with no health insurance, and the doctor of my dreams moved down to Florida. So I was stuck again. That next year, which is this year, my husband got a new job, and we got health insurance. And here we are. I had the surgery last month on the 22nd, and doing very well so far. My next video, I'll talk more about surgery day, everything that you need to know about surgery day, and how I felt afterwards. If you have any questions, feel free to put it down in the box. I'll try to make sure that I answer questions in the comments and in the videos. And I want to say that's just about it for this video. Please, please, please don't be afraid to ask any questions that you may have. And I will do my best to make sure that I'm posting videos weekly and at a timely manner. And I look forward to this journey. I will explain more about the route of the surgery that I went, which was the external fixator route. There are other options. There's an option where you can have the bone graft, where a piece of bone is taken from like either your ankle or from your hip and put into your toe. But I didn't go that way because my doctor didn't want to go that way. And there are some pros and cons with that way, but I have seen beautiful things done with the bone graft surgery. I just didn't go that way because my toe is so short. If I pick a piece of bone out of my body and they put it in there, either my blood vessels may not grow back good enough and my toe can die, or or they can not get a piece of bone long enough and my toe can still be short. So there were some things I decided to go with the external fixator so it can be a gradual lengthen and we can come back and we can check and stuff like that. So like I said, feel free to ask any questions that you'd like. Next video will be more in depth. There'll be pictures about before and after pictures and pictures after I started turning my fixator, and I'll explain what that means too, and I'll post a little video at the end of what turning the fixator looks like. So I hope you guys are down for the ride for this journey, because I am, and I look forward to speaking to you all. Thank you again, and good night.